Hi, my name is Elsa. This is a demonstration video of PO and IM medication. Today our patient here is Millie Larson. Millie's date of birth is 1/1/1936. She has no known allergies. So I have gathered my supplies. I have the medication, a med cup, some water, the sharps container, my syringe, my needle, the medication as well, and I had improvised, and I'm going to be injecting into a banana. I can't hold much with this hand, so I needed something that would lay flat. So my first step would be to wash my hands. Now we're going to be looking at our MAR. I have it here on the screen. Millie is going to be getting Dococet 100 milligram, an oral tablet by mouth now. So I'm looking at the medication. I'm checking the expiration date. It does not expire till 10/2023. It is Dococet 100 milligram tab. So I'm going to pop it. So I'm popping the medication into the med cup. Then next we're going to be giving Millie haloperidol 2 milligrams IM. So I got my little vial of haloperidol. You can see it. And its expiration date is 6/20/29. And Millie's dose is 2 milligrams. This vial brings 1 ml and it's 5 milligrams in here. So we have to do the math. So Millie is only going to get 2 milligrams, which equals 0.4 ml. So we shall begin. When we are preparing medications, we want to make sure that we're looking at all the rights and we're checking the medication order, comparing it to the medication itself at least 3 times. So you open your syringe, you take it out of the container, you open your needle, you twist the needle in, you pull it out of the container, you can place it down. So you have the Haldol right now. You uncap it, you expose the hub, you get an alcohol prep pad, and you open it, and you cleanse your hub. You take your syringe, you draw back air to be 0.4, which would look like that. So you have the syringe and then the Haldol. You push the air inside, you invert it, you draw back the desired dose, 0.4. You make sure you don't have any air bubbles in. You remove. Then you do the scooping. And now you're ready to give Millie her Haldol and her Colace. One of the things that I did do off camera was to label your syringe, just with the medication and the dosing, usually the date and the time that the medication was drawn up. So we're gonna go administer the medication for Millie now. So I arrived in Millie's room. I'm going to wash my hands. Hi Millie, how are you? My name is Elsa. I'm going to be your nurse today. We have some medication that the doctor has ordered. What's your name? And what's your date of birth? I both ID'd the patient as Millie Larson and compared it to her ID band. She does not have any known allergies, so we're going to proceed with a medication administration. All right, Millie, we're going to take some Colace. All right, wash it down with some water. If I would need to assist her, I would don gloves to put the pill inside her mouth and help her with some water. I will be donning gloves for this IM, but I don't have a glove that fit this hand, and it's kind of hard to put on a glove on this hand, so we're pretending that I have gloves on for this portion. We're going to be administering the Haldol into the ventrogluteal site. So what we're going to do is we're going to have Millie lie down on her side. And we're going to use her left hip. So we're going to use our right hand. So we're going to locate her greater trochanter and superior and anterior iliac spine. With the palm of your hand on the trochanter and your middle index finger on the anterior and superior iliac spine, and then your middle finger is going to point towards the iliac crest. That's how you're going to know where to position your IM. You're going to be injecting between your two knuckles where your hand makes the V. We're going to be alcohol prepping the area in a circular motion from the inside towards the outside. You want to make sure we have also gauze while that dries. Our gauze, as well as some tape in case they need a little band-aid. Proceed and make the V where we had previously located it. Uncap your syringe. You're going to make the skin nice and taut, and then you're going to inject in a 90-degree angle. Insert the medication. We're going to pull out, apply pressure, put the safety device. Make sure we're disposing of the needle in the sharps container. We're going to check the site, make sure it's not bleeding. You can put a little bandage there. And secure the bandage with some tape. So we have injected Millie on her left hip. There's her little bandage. Hi, Millie. How are you doing? That wasn't that bad, huh? All right. So we're going to proceed to make Millie as comfortable as possible in a safe position. Then we're going to proceed out of the room. We're going to make sure we wash our hands. So we have administered the medication to Millie. Now it's time for documentation. So we have given Millie 100 milligrams of Colace. We're just going to initial IC. And then we have also administered an IM injection of haloperidol, 2 milligrams, to Millie, to her ventrogluteal sites. So we're just going to make sure that we are documenting the ventrogluteal site for Millie.